So let's take a walk through a traditional patient room and find out where our infection control opportunities are and where our cross-contaminations are. So we foam into the room, we come in and we get our gloves. And now when we have our gloves on, we go address our patient. We come over and greet our patient. We may or may not touch them. Then we go grab the nurse call button off the rail and give them their nurse call button in case they need some further help. So now we've touched that. We are gloved, so we've touched that. But we've now technically cross-contaminated ourselves on that. So if there's nothing else we're going to do with the patient at the moment, then we're going to take our gloves off and we're going to dispose of them. And now we have to clean ourselves because we don't have any foam in the room. We either have to go to the sink or we have to go back outside and use the foam outside. So now we're going to go back into the patient room. We're going to grab our gloves again because now we want to put the patient on oxygen or take some vital signs. So we go to the other side of the bed. And again, we're talking to the patient. We may touch a patient for taking the pulse. We may apply EKG electrodes. But again, we're taking, precautions with our gloves on. Then we're going to go over here. We're going to grab some items that we need for flow meters because the oxygen stuff is on the other side. Again, we've touched the underside lip handle of a drawer. We've touched the side railing of the bed. And again, we may touch again the patient by applying electrodes and such. But again, there's no decontamination option at the bedside. And the only thing we can do at this point is walk out and use foam again and then walk back in. So what we're trying to do is optimize the location of hand sanitation devices to optimize the use of them to prevent further spread of diseases, hospital-acquired infections. And we have to remember to go back to Gemba, where work takes place. Work takes place in the patient room where the patient is, not outside in the hallway.